following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
Welcome to Doctors on Call. Tonight's topic, blood and bone marrow transplants. Two experts are here to answer your questions. Now here's your host, Dr. John Phillips.
Good evening. Cancer treatment can and often does save lives. But when chemotherapy or radiation therapy don't work, sometimes the best treatment, the only option left, is blood and marrow transplantation. It's a procedure that has given new life to patients with diseases that were once considered incurable. Who is a good candidate for transplantation? Who would make a good donor? And most important, how can blood and marrow transplantation save lives? We'll get answers to these questions and more from our two guests, Dr. Michael Craig, Director of Blood and Marrow Transplantation at WVU's Mary Babb Randolph Cancer Center, and Dr. James Abraham, Medical Director of WVU's Mary Babb Randolph Cancer Center. If you'd like to ask our guests a question, give us a call. Our phone lines are open now. Michael, we'll start with you. Can you go ahead and explain to us exactly how blood and marrow transplantations work?
Sure. So the general idea behind something like a blood or marrow transplantation is that a patient has something wrong with their immune system, or they have a type of cancer, and something like leukemia, something like lymphoma. And what we generally do is we decide which type of transplant a patient would need. Sometimes patients are able to serve as their own donor, meaning we can collect their blood cells and give them back to them after the transplant, so they rescue themselves. Sometimes we need another donor or a transplant from another person to rescue them. But the general idea is that we use high doses of chemotherapy, so very high doses of chemotherapy, to try to overcome the resistance of the cancer, and then we give them back stem cells or blood cells to rescue their immune system. Sometimes the cells come from a different person, in which case we're using that other person's immune system to attack and keep the cancer from returning. Sometimes the patients who serve as their own donor, we just use the very high doses of chemotherapy to try to keep the cancer from returning.
Okay.
So in general, we have two choices when we talk about transplants: patients who can be their own donor, and then sometimes patients who need another person to be the donor.
Okay, very interesting. Well, James, there's a lot of type of cancers out there, and now transplantation isn't necessarily the treatment of choice for all of them.
Right.
Which in particular would you be using transplantation for?
It's very specific diagnosis, as Mike said, cancers of blood cells, or what we call as leukemia. And the leukemia can be an acute or chronic leukemia, or the cancers of the blood can be just happening right now, or it can be a prolonged type of disease. So leukemia is one diagnosis. Second, we use for lymphoma, or cancer of the lymphatic system. And then there's another type of blood problem, which is what we call as multiple myeloma, and then another problem, aplastic anemia. So these are some of the examples of diagnosis transplant is commonly used. Okay,
very good. Well, we're talking about blood and marrow transplantation tonight. If you have a call, the number is on the screen. Please give us a call. So, Michael, let's talk a little bit more about transplantation. Who, first of all, would be eligible for it, and then how do they prepare for transplantation?
So transplant candidates, they can be of almost any age. We offer transplants up to patients even into their early 70s, especially with diseases like multiple myeloma or lymphoma. These patients may be older adults, they may be young adults. Their transplants are done in children and small children even as well. So it depends a lot upon the diagnosis as to what age group that people can be from when they're offered a transplant. If we take a general adult, it's usually the most common reason to have a transplant is for multiple myeloma or lymphoma. So you have a cancer of the blood or a cancer of the immune system, and what we generally do for those patients is we go about the process of collecting their stem cells. So we often give them a chemotherapy and an injection to try to bring their stem cells into the bloodstream, and then we can collect them and we can freeze them away. Next, the patient will go through high doses of chemotherapy. So a very high dose of chemotherapy that may last a day or two, or sometimes even last up to a week. Afterwards, they get their cells back. We can bring them out of the freezer, give them back to the patient, and then they regrow their white count. They regrow their immune system, and their blood system has to regrow afterwards, which generally takes about 2 to 3 weeks to do in general.
So why wouldn't those stem cells, again, become cancer?
So the idea is that to prevent them from becoming cancer, what happens to the patient is we want them to be in a remission. We want their lymphoma to be in a remission, or we want the cancer in the patient to be at a very low level so that we can collect stem cells that don't have cancer in them, that are not malignant or don't have the ability to become cancer, and we can freeze them away. So what we rescue the patient with, hopefully, is a very pure product that will have low chance of giving the patient back their cancer again.
Now, so some patients, however, wouldn't be eligible for that, and they'd need an alternative donor.
Right. So if a patient isn't a candidate to receive their own cells, usually the cause of that is that they have something wrong with their bone marrow. So they have something like leukemia then that lives in the bone marrow space or lives in the blood system. So we couldn't get a very pure product out of a patient that has something like leukemia, in which case we would look for a person that matches the patient, usually a brother or sister, or we can also search out into the rest of the world through an organization called the National Marrow Donor Program. And the National Marrow Donor Program has millions of people on the registry that we can try to find an appropriate match for the patient that needs a transplant, that needs a new immune system.
Okay, very good. Sure. We're going to get back to donors, but we already have our first caller. It's Nancy from Harrison County. Nancy, welcome to Doctors on Call.
Yes, good evening, and thank you for taking my call.
Well, thank you for calling. What's your question?
Yes, I was wondering, for about a year, I have had bruising, and I wonder if any of the leukemias would present with, these are like burgundy bruises. Now, I've seen Dr. Brager. He's going to check the platelets again next month. I saw him in August, Dr. Paul Brager at UHC. And I was wondering, do any of the leukemias present with this type of bruising?
Okay, very good. Is there a particular place where you're bruising?
It seems to be mostly on my arms and hands. I'm 69, but I'm fair, and I always did bruise easily in my life. But I think the platelet count, I believe in August, was 210,000, I think.
Okay.
Now, I hope that's right. I think that's what Dr. Brager told me.
Okay.
But we're checking it again December 7th.
Okay.
And I was just wondering.
Sure. Well, let's ask our experts. So Nancy has some bruising.
Nancy, thank you for that question. It's an excellent question. Since you had it for almost a year and it's been evaluated by all the routine or basic tests, I don't think, and we know Dr. Brager very well. He's an excellent doctor. We don't think that's leukemia. So as you said, it could be a platelet problem, and a platelet problem could be an issue with the number of platelets or even the function of the platelets.
Real quick, can you just explain to the audience what a platelet is and what it does?
Right. Platelets, there are 3 cells in our blood, and there's a white cells, and that's what we were talking about, the leukemia, and the cancer of the white cells, and then the red cells, which carries the oxygen to the tissue, and platelets, which actually prevents the bleeding. So as Nancy's saying, she has some bruising and the bleeding. It could be a function of the platelets, and most of the time, a lot of time we see this when the platelets are not functioning well, and sometimes it could be some of the medications we're using, even aspirin or ibuprofen, sure. Some of the medicines we use commonly, antibiotics that can do that. Sure. So there are some platelet function tests they can do and find out if that's the cause. And rarely, again, in young people, when we see bleeding or bruising, we worry about a factor problem. If there is a bleeding factor which is not there, which actually helps in controlling the bleeding. So I'm sure Dr. Brager has done all the battery of tests. But your question is, can a bruising be a symptom of leukemia? It can be. Sometimes when we see patients with certain types of leukemia, blood problem, That's one of the signs. But it's an easily, they can do a blood count and see what's the number of platelets or what are the number of white cells and the red cells, and they can make a diagnosis of that. Yeah.
So start there with a blood test.
That's right.
Very good. Well, good luck with that, Nancy. Our next caller is Al from Cabell County. Al, welcome to Doctors on Call.
Hi, how are you?
I'm very well. Do you have a question?
Yes. About 10 or 12 years ago, I lived up in Pennsylvania, Philadelphia area, and they had a girl, I guess it was a girl, a little child that needed a bone marrow transplant. And they were trying to get donors to submit blood samples to get a match. And I submitted my blood sample to get a match, but I guess I never heard anything back, so maybe I wasn't a match. But my question is, how do they match those up, and do they have a database? In other words, would my blood sample have gone into a database to be able to contribute marrow for somebody else?
Great question. Great question, Al. So he led us back to the original topic
Yes.
we talked about.
So the way that we look for a donor, for a patient that needs a donor, it is a simple blood test. We can also see if a patient has a match based upon even a swab in the mouth to try to find out. Essentially, what we're looking for is we're trying to find a match of the immune system. So we are looking at a specific way that our immune system recognizes us from another person or from an infection, and that is called HLA typing. It's a specific blood test that we do to see if the patient has a match. And what we do with this HLA typing is we find out what type the patient is, and then we can search in a database. There is a very large database that's housed in the United States that's organized through the National Marrow Donor Program. And it has millions of donors on it. And we also collaborate within the United States with registries in foreign countries, in Europe, Asia, Australia, all over the world. So we can search all over the world to find donors for patients who need them. There are donor drives on a regular basis. And most people who need a transplant, for over 80 to 90% of them, we are able to find a donor for them by using the registry and by searching international databases to look for a registry. So what it sounds like he went through was a donor drive to try to see if they could enroll more people on the registry. And over time, as more and more people may need a transplant, it may be that someday he would be called because he may be a potential match for a person who needs that. But there is a large registry that we keep track of and that we contribute to and that we search regularly to find donors for patients.
So is that going to be through the Red Cross, or just, will Al's name definitely be on there? Or?
It's not actually through the Red Cross. It's actually through the National Marrow Donor Program. It is a separate organization that is, it's a federal organization as well. It's federally funded, and it's a public organization, somewhat like the Red Cross, except they're not bringing red cells and they're not bringing platelet products to us. They're bringing someone's new immune system to us. So it's a very specialized center, and it's housed in Minnesota, and it's a very, a great organization. They have an excellent website as well that is available for patients and donors, and we refer patients to that website all the time to help answer a lot of these questions and issues. I can't promise that his typing went there 10 years ago. The organization has been in operation for about 20 years now, but I can't say for certain how that was done. But probably if he did a donor drive, his typing probably on some level is available to be searched. There are millions of people on it.
Okay, so a blood drive, when you're just collecting blood for use, that blood has an expiration date. Would this just be you're tested, you go into the database, and then you your information is there for use later on?
Right.
It's a total separate issue than blood drive,
Okay.
actually. When we have a donor drive, we're looking at the immune system part. It isn't not to donate red cells or platelets or any of those things. It's a total separate way of trying to do that.
Okay.
But I think what Al did is a great thing. When first he volunteered and he tried to help the little girl, and then now hopefully his database is in, his typing is in the database, and I'm sure someone else will be helped by his blood. And then we strongly encourage people to register themselves for the transplant because, as we were saying, this is probably one of only choice for that particular patient go through a transplant. So we actually really depend upon the number of people in this database to find a donor for our patients.
Okay, so in Al's case, they sort of put the word out to the whole community, but most of the times it's going to be a family member that's
we
likely
look
to be
for
a match?
we look for brothers or sisters first, because there's a fair chance that we'll find a match there. If we do not find a match from a brother or sister, then we'll look out into the rest of the world.
Right. One in 4, 25% chance, right?
Okay, very good.
Al also brought up another important point about going through a transplant, and that is that we definitely need people to volunteer through the Red Cross to donate blood products as well. Sure. Most of our patients who go through something like a bone marrow or blood stem cell transplant will need blood products. They'll need blood products to survive the procedure until they can grow their new blood system. So even if he was through the Red Cross to donate blood products to hopefully help the little girl, that process will help us immensely as well. So you may not be a donor, but you may be a red cell donor or a platelet donor for somebody who desperately needs blood products as well to get treatment for leukemia or any type of cancer.
So this is a plug for all of our audience members to go out there and be typed and donate blood as well. We have our next caller is Eileen from Mingo County. Eileen, welcome to Doctors on Call.
Hello. I'm a 50-year-old woman, and about 2 years ago I started having problems with my blood. And the blood count got real low, and they had to put me in the hospital, and they give me like 7 units of blood. Okay, my doctor's done the bone marrow plant, and they've done a lot of tests on me, and everything so far has come back good. And I just wondered if you had any idea what keeps my blood count low.
Specifically, do you know which line of your blood cell? Is it your red blood cells that are
Red.
low? Or?
It's my red.
Your red ones, okay. So Eileen has low red blood cells persistently.
So, thank you for that question, Eileen. So as we said, there are 3 types of cells: white cells and red cells and platelets. So red cells, the most common cause we see in the community is, we can say either iron deficiency. So let's just say somebody has nutritional deficiency, which can lead to a low iron, and iron is so important for producing red blood cells. Then another cause of iron deficiency is bleeding. If they have some kind of chronic bleeding, it can be, in different patients, it could be due to many reasons. Bleeding from our stomach or colon or one of those things, or we can bleed from different parts of the body. Bleeding is one of the causes. I'm sure the doctors looked at all those things. So nutrition, bleeding, and then sometimes what happens is our body kind of destroy our cells. And that can damage the red cells, and that can bring it down. And as in Eileen's case, they actually looked at the bone marrow where all the cells are produced. So decreased production or increased destruction. Some of these things can be identified by the tests which can be done from the marrow. So since you had all these tests done, I hope your counts are well now and it's staying up. I think you should continue to follow with your family doctor and your blood doctor or family doctor. Make sure it doesn't happen again. Make sure that we haven't missed any other tests, which is done in her. I don't know, Mike, if you have any.
So yeah, I think about people. Anemia is a very common problem, and as Dr. Abraham said, there's usually either they have lost blood or they can't make blood. It's a box, and either it's coming out the bottom or it's not getting enough, is not being put in when you're anemic or your red cells are low. So sometimes patients have to go through lots of tests to try to find out the cause for their anemia. It may be as simple as taking something like iron or other injections to replace it.
Right. Very good. Well, good luck with that, Eileen. We have lots of callers on the line. Let's move to Kim from Taylor County. Kim, welcome to Doctors on Call. Do you have a question?
Yes, thank you. My question surrounds the actual research and the search for the candidate, the cost associated with that.
Okay.
What type of costs are associated? Is that the most costly piece of actually the whole process?
Sure. So Kim's asking, looking for the donor, how much does that cost? Who pays for that?
So when we're looking for the donor, to type a potential donor, the cost is somewhere between $600 to $1,200 to do a preliminary screen to see if they are a potential match. So in most cases, unfortunately, most insurances do not cover such a thing. So patients have drives to try to raise money and we look for a grant, we can actually apply through the National Marrow Donor Program for a grant to help pay for some of the cost of typing. Brothers or sisters are typing unrelated donors to see if they would have potential matches. But it is...
And insurance won't pay for that?
Insurance generally does not pay for typing.
It's up to the family to come up with the money?
Up to the patient and the family, and we will try to help as best that we can to raise resources and to raise that money. But to do a fairly straightforward screening is somewhere between around $600 per person to screen. And unfortunately, it isn't generally covered by insurance at this time.
Okay.
But it is not the most costly part of the whole procedure. By far and away, a transplant like a stem cell transplant is an extremely costly procedure associated with significant time in the hospital, significant cost upon recovery, and so it is a very costly procedure. There's no doubt about it.
Okay, interesting. Our next phone caller is Elizabeth from Marion County. Elizabeth, welcome to Doctors on Call.
Thank you very much. Good evening, and thank you for taking my call.
You're welcome.
I was diagnosed with multiple myeloma about 10 years ago, and at the time I was told I had indolent multiple myeloma, and that the illness would progress very slowly, and I decided not to seek any kind of treatment. I have never had chemo, never had radiation. I tried to have a good diet and exercise and do all the right things. My question is, at what point does a physician decide when a bone marrow transplant is necessary? And do we have any kind of data about the success rate of those transplants?
Excellent question.
I can start with, and so that's good. I'm glad you're doing very well. And you said many years with the diagnosis of multiple myeloma. So multiple myeloma is a cancer of plasma cells, one of the cells in the bone marrow. So it could be a tough diagnosis, but as Elizabeth said, it's for her it's an indolent or low-grade disease, and I'm glad she's doing very well. But the question is when we decide about transplant and when we decided to go in and do more aggressive treatment. That's especially when we see a large number of these plasma cells or abnormal leukemic cells in the marrow, or if we see it's progressing rapidly. So how do we know that? By many symptoms like anemia or bone pain or any changes in some of the numbers in kidneys and different parts of the body. So if the patient is symptomatic with any of these things, we decide to go in early on, and then either some form of chemotherapy or radiation if it's a bone involvement, or transplant. And so we decide mainly depending upon the pace the disease is progressing.
Okay. So go into more depth about the actual symptoms that a patient may see with these types of diseases.
So a patient with something like multiple myeloma, they may develop fatigue and feel exhausted just because they become more and more anemic. As the myeloma progresses, they may develop kidney problems. Kidney failure is another common sign, and bone pain. That's another common way that people with something like myeloma presents, because they have holes that erode into their bone from the cancer themselves. When myeloma, in some patients, they're very fortunate because it was a very slow growing process that may not change or progress even over years. Others will not be so fortunate. They will progress much more quickly or have symptoms when we find out that they have multiple myeloma, so they definitely need intervention and therapy then. People with lymphoma will have different symptoms. They usually have swelling or lymph nodes that grow, or they have pain from those lymph nodes growing. They have night sweats and other types of things that may develop as well. Many of these cancers of the blood and myeloma and lymphoma, they often have atypical or severe infections as well, and that may be something that kind of leads to us to look for something like myeloma or to look for lymphoma as a cause of that happening.
Very good. Well, we only have about 2 minutes. I want to get quickly to Kathy from Lawrence County, Ohio. Kathy, do you have a quick question?
Yes, I do. I was diagnosed about 3 years ago with polycythemia vera, and I am being treated at the Cleveland Clinic Taussig Cancer Center. But my question is T. vera considered a type of leukemia? I've done a lot of research on it, and some doctors say that it is. Others classify it as just a blood disorder that can go into leukemia. And, having issues with insurance, I'd just like to know the answer to that, what your opinion is.
Great question.
So in general, we classify polycythemia vera technically as a clonal myeloproliferative disorder, or an overgrowth of blood. So instead of being anemic or not having enough blood, you actually make too much red cells, and sometimes you need medication to control that, or you need to have blood removed at times to help control the symptoms.
Are the cells themselves normal?
The cells themselves are probably not normal. So it's in one of these greatly debated areas, actually, unfortunately, in hematology right now. Is something like this a true cancer? Most people are falling on the side of it not being a true cancer, meaning they are growing and they do overgrow, but they don't necessarily call it a cancer until it transforms to something like leukemia, which it rarely can do. But technically, most people probably aren't classifying polycythemia vera as a cancer.
Excellent, very good. Well, thank you all very much for your phone calls. We have been speaking tonight about blood and marrow transplants with Dr. Michael Craig and Dr. James Abraham. Thank you both for being with us. If you would like more information, see your family doctor or visit our website at wvuhealth.com. For Doctors on Call, I'm Dr. John Phillips. Good night and good health.
Join us again next week for a special 1-hour edition of Doctors on Call. The topic, swine flu.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.